The U.S. Centers for Disease Control estimates 5% of all hospital admissions result in infections acquired during a patient's stay while receiving treatment for other medical conditions. These infections are believed to contribute to 99,000 deaths each year at a cost of $33 billion. Multi-drug-resistant pathogens such as C. difficile, MRSA, and VRE are especially dangerous to patients as these microorganisms are resistant to multiple antibiotics. Studies show that even with optimal terminal cleaning practices, an operating or patient room can remain the source of many of these drug-resistant microorganisms, as manual cleaning effectively cleans less than 50% of surfaces. To help combat hospital-acquired infections, hospitals are looking to innovative technologies such as the Aseptix 2 by Sanuvox Technologies. Since 1995, Sanuvox Technologies has grown to become a global leader in air and surface disinfection. Sanuvox UV systems use germicidal ultraviolet light to penetrate and deactivate the microorganism's DNA, sterilizing the biocontaminant. Commercially available mobile UV disinfection systems are effective in disinfecting a patient room following the terminal cleaning process, but require multiple positioning to reduce shadows. Unlike conventional UV disinfection units, the Aseptix 2 system employs 2 high-intensity UVC towers to efficiently deactivate pathogens without having to reposition the UV system. No other medical UV disinfection system has the ability to treat a patient or operating room as efficiently and effectively as the Sanuvox Aseptix 2. The Aseptix 2 UV system is built strong, yet light, allowing for one-person operation. The standing caution sign may also be used as a coupler, joining both Aseptix 2 units together, allowing for easy maneuverability. The Aseptix 2 system is safe, controlled by any Wi-Fi enabled smart device. The protected, easy-to-use interface makes selecting the right disinfection cycle an easy one. The Aseptix 2 is also equipped with an onboard data logger, allowing each disinfection cycle to be recorded. A suite of 8 onboard motion detectors will monitor the room and interrupt the disinfection cycle should anyone enter. Add the Aseptix 2 to your present terminal cleaning regimen, and rest assured knowing you are doing the most for your patients, staff, and visitors. To learn more about the Aseptix 2 features and benefits, visit our website or speak with one of our team members. The Sanuvox Aseptix 2 is designed to be as simple to use as it is effective. Watch this short video to learn how to use the Aseptix 2 disinfection system. Prior to disinfection, make sure the room is vacant while placing the floor and door signs signaling that a disinfection cycle is in progress. Prepare the room for UV disinfection by lifting the bed rails. Place frequently used items near the disinfection system so the UV rays can irradiate their surfaces. Tubing, monitors, remote controls, and tables can be placed close to the UV disinfection system. Unroll any cables so the surfaces can be exposed. Wheel in the Aseptix 2 systems into the room. Always use the handle when maneuvering the system. Refrain from touching the UV lamps with bare hands, as oil from fingers may reduce efficiency. Place a UV tower on each side of the patient bed and use the wheel locks to secure the units in place. The use of the 2-tower system reduces shadows that block the sterilizing ability of the UV light. Once the units have been set in place, retract the 15-foot power cord to its desired length and plug it into a wall outlet. Make sure to plug each unit into its own power outlet as to eliminate any chance of a power surge. The system is now ready to begin its disinfection cycle. To remotely start the Aseptix 2 with any Wi-Fi enabled smart device, find the wireless network Aseptix 2 and enter the password. Open a web browser and type the HTTP address supplied by Sanuvox and select Enter. The Aseptix 2 web page will open. Enter the room number and select Start. If there is no room number, there will have to be at least one character entered. A 30-second countdown timer will appear on the screen. An audible signal will also notify that a disinfection cycle is about to begin. A manual disinfection cycle can also be performed by pressing the green button located on the primary unit. The audible signal can be heard upon pressing the green button. Following the countdown timer, both UV towers will illuminate, disinfecting the room in 10 minutes. The smart device will notify the user following a successful disinfection cycle. The units can then be unplugged. The power cord can be easily retracted with one click. Slowly guide the cord back into the unit. The Aseptix 2 system can now be removed and continue on to disinfect another room. Should the disinfection cycle be interrupted, an error message will be displayed and the disinfection cycle will have to be restarted. For more information on the Aseptix 2 ultraviolet disinfection system, to learn more about the Aseptix 2 features and benefits, visit our website or speak with one of our team members.